Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. In this presentation, we are going to look at Medicare Part D, prescription plan, and the mystery donut hole. So let us begin with the feature presentation. As you know, Medicare Part D covers the prescription. It is part of Advantage plans like Medicare Part C, or it could be an independent policy that covers your prescription costs. So let us look at what this Medicare Part D prescription covers and how much does it cover and what it does not cover. First of all, on January 1 of any given year, you begin with a new cycle of Medicare Part D prescription. That means whatever the deductibles and copays you had met in the previous year is history. With the new year, a new cycle begins. The first phase is the deductible phase, starting on January 1st of a given year. The deductible for, typo here, the deductible for year 2021 is $445. That means you pay the first $445 for your prescriptions before the prescription Part D kicks into action. Next, we have the initial coverage phase. That is, you pay your copay or co-insurance until you reach $4,130. The copay and co-insurance can depend upon your policy and also depend upon the various riders. Then comes the mystery donut hole phase. This is the place where you don't have the full coverage, where you can just pay a fixed copay and get your medications. And it is during this donut hole, after you have reached $4,130, the brand names will cost you 25% of the medication price. Similarly, there could be 25% charges for generic drugs until your prescription total reaches $6,650 for year 2021. And once you reach this, you go past this, I call this like a center of the hurricane, where you're getting the biggest hit. Once you go past this eye of the hurricane, then you enter the catastrophic phase or catastrophic coverage phase, where you pay 5% of the drug cost, especially if you're taking like chemotherapy or drugs for any kind of rare medical conditions which can run into several $1,000s. This is where the catastrophic coverage comes into play, where you pay only 5% of the drug cost. But the catch here is, let's assume that you were diagnosed to have a critically ill condition in October or November. Then you're paying 5% for these catastrophic drugs, which are extremely expensive and some of them are experimental. You're paying 5%, but on December 31st, the calendar is reset. That means starting January, now you're going to start off with the same cycle as we started here in the beginning. This is a quick overview of Medicare Part D prescription plan, this so-called donut hole, and what is covered and how much you expect to spend during the entire year. Again, how much you spend depends upon the number of medications you are taking and the cost of these medications. Take, for example, Xarelto, which is a blood thinner used for patients with atrial fibrillation. The market price of Xarelto is like $440. Even if you have a prescription plan, it could still cost you substantially more than if you were in this copay period. I hope this has been useful to you, and please do subscribe to our YouTube channel. And if you would like me to research on any particular topic related to medical coverage, prescriptions, Medicare Part A, B, C, D, please do subscribe to our channel. Thank you so much for watching.